Hey community, we're back and I'm Brandy B, the community MP.
And I'm Brandy G, the community NP.
And together we are
B&B, the community NPs.
So today we're going to talk about the newest COVID vaccine.
Okay.
So it's by Janssen Johnson.
Okay.
And just like the other ones, it's a vaccine designed to protect you from the COVID-19 virus.
Okay. So before we get started, have you received your COVID vaccine yet, B?
I have not.
What are you waiting for?
Data.
Okay.
Have you?
Yes, I have.
Okay.
I received my first vaccine last Friday. And to be honest, it wasn't bad. The only side effect I had was like pain at the site of injection. Yeah. And it lasts probably 2 to 3 days, the pain.
Okay.
But then it went away. So I get my second vaccine in 30 days.
Okay.
On the 16th, in 30 days.
So to be honest though, like I think that I feel like I'm exposed to probably COVID so much that I think that my body is, and this may just be my opinion.
It is.
But I think that maybe my body's exposed to it so much that like it's like getting the vaccine. So
let me tell you. So I can say that getting the first vaccine, it gave me a sense of relief.
Did it?
Like it did. Like subconsciously, I'm like, okay, you got your first vaccine.
Yeah.
Maybe you can do more.
Yeah.
Like I can't wait to get the second vaccine. I feel comfortable. Like I'm not like I'm still wearing a mask, a face mask and stuff when I go out. But it just gave me some type of peace.
Yeah. But COVID hit home pretty close for you.
I know. So it just gave me some type of peace. So let's talk about the Johnson & Johnson vaccine.
Okay.
All right. So like you said, it's authorized for
emergency use only.
for COVID-19 vaccine. It's recommended for persons 18 years of age and older. And there's only one dose. So that's the good thing about the Johnson & Johnson vaccine. It's only a single dose.
I've had several people ask me if they could get that one. But, you know, at our clinic, we don't have it. But I'm not sure where they are giving it out at.
I know a couple of the drugstores had the Johnson & Johnson because a couple of patients that I've seen, they have been to Kroger's and they had got the Johnson & Johnson from Kroger's.
Okay.
So
so check with your local pharmacies.
So it cannot be interchanged with the other vaccines. Right. I had a patient told me, she was like, I got the Moderna, but can somebody call about another list and it had Pfizer? I was like, no.
Yeah, no.
If you got the Moderna, you need to go back to the same site and get your second dose of Moderna.
Right.
Don't interchange the vaccine. So it can't be interchanged with the other vaccines.
So get Moderna for your first, Moderna for your second. Or Pfizer, and with Johnson & Johnson, it's just one.
Yes. Okay.
And then this is important because a lot of times people are getting, like flu shots and
shingles, pneumonia, tetanus.
Yeah. And this goes for all of the COVID vaccines. So you can't get any other vaccines within 14 days. So no 14 days before or 14 days after. So if you get the COVID vaccine today, you don't need to get any other vaccines for 14 days. And you kind of want to just wait until you're done with your second dose because it'll be cutting it close.
So that's been my recommendation to my patients this week in clinic. That we're gonna wait. A lot of them are due for their tetanus shots. They're due for shingles vaccines. So I told them we're gonna wait. Yeah. I'd rather them go ahead and get their COVID vaccine, get that out the way, then we can go back to getting the other vaccines.
Right. Yeah. Because this is what's most important now.
Yes.
And then so the latest information shows that the Johnson & Johnson is 85% effective.
Okay.
So do you remember what the data was on the other two?
I don't. I can't recall.
I know it was in the 90s.
Yes, in the 90s.
And I think Moderna was most effective.
Yeah, I can't remember. I'm not going to tell a fib live. I can't remember.
Oh my gosh.
Right. So,
but you can go back to our previous videos and see what the effectiveness of the other ones are.
Okay, so some of the contraindications. If you have allergic reaction, you allergic to the vaccine. Okay?
Don't get it. Don't get it.
I guess you wouldn't know because it's a new vaccine.
Yeah, so but if you get it and you have an allergic reaction, don't try it again.
Don't get it again. Okay,
right,
if they offer it next year or whenever they offer it, don't get it again.
Like,
okay?
Nah.
Any type of immediate allergic reaction, any severity, you need to seek medical attention. Hopefully, where you at, they're making you sit down and wait 15 minutes after you get the vaccine to see if you have a reaction. If you do, then you can go ahead and seek medical emergency attention if needed.
Yeah.
Okay.
So some of the side effects, like you said, you had the pain in your arm. And this is not just, the pain in your arm isn't just a side effect of these COVID vaccines. It's any vaccine that you get into your muscle because you're damaging the muscle responds, and you feel the pain. So you may have swelling, and then that's just at the injection site. Throughout your body, you may have fever, tiredness, chills, headaches. I've had a couple people tell me that they've had like upset stomach.
Okay.
But those are the most common.
So I had a couple of people who said they had fever. They had flu-like symptoms after taking their second dose. Usually the second dose, like of the other two vaccines. They had some flu-like symptoms. I haven't met anyone outside a couple of patients who had their first dose of Johnson & Johnson. But majority of the people had the first two vaccines, and that was one of the side effects after the second dose. But it went away. It went away like pretty quick.
Yeah. My brother got his second dose of Moderna, I think, and he said that for his second dose, he just has pain all up his arm and neck. So.
Oh, for real?
Yeah.
Okay.
But that's with any vaccine, like I said. Don't get your vaccine because you're afraid that your arm's going to hurt.
And we're going to get Brandy to get her vaccine, you guys.
Just move your arm around a lot to loosen up that muscle and reduce the pain.
Yes.
And I have to be honest. When I traveled out of the country, I kind of felt like, oh, maybe I should get the vaccine because then I would have a little bit more peace of mind.
Yeah.
Because whenever I was getting my test done to come back to the United States, I was like,
would it be positive?
Yeah. I mean, as much as I like Jamaica, I mean.
I thought the same thing. I was like, if I'm positive, well, I'm going to stay at this resort. So that's not a bad thing. But I'm like, how long am I going to stay here? The people going to quarantine me in a room?
Yeah.
They're going to by myself at the,
Am I going to get room service?
So it's scary.
Yeah.
It is. Because I was nervous. I was like, oh, I hope I didn't get COVID in Jamaica.
Yeah. And then, so when we were getting ready to leave, they didn't email us our results, and I was like, we're positive. Ooh. Oh, my God. So then we're, like, panicking. Our car's here to pick us up, take us to the hotel. I'm still waiting on my results. We ended up having to go to the nurse. So we were negative, but it was still just like, man, well, if I would feel better if I had got the vaccine. I would probably be a little more.
It gives you a little peace. And I've talked to other some of my friends who are providers, and that's the first thing that they say. It gives them a peace. Like, it gives them a peace. It may be a superficial peace, but it does give them a peace of mind.
Yeah. And as much as we are exposed, I think, it's important.
So Brandon's going to get a vaccine, y'all.
Anywho, so also on this, with the Johnson & Johnson, the CDC can track, if you download the
V-Safe app.
Yeah,
V-Safe
app. And then they, like, you can put in side effects, you put in when you got the vaccine, and it is able to track all that, and it gives them more data to, provide to the world about how, the safety and how effective the vaccine is.
Okay, so some tips after the shot, some tips that you can do after the shot. So just to reduce the pain and discomfort, you want to apply a clean, cool, wet washcloth to the area. Use or exercise that arm. I'll tell my patients anytime you get a vaccine, go do some exercise.
Yeah,
especially
it'll work them. It'll help the muscle.
Yes. What else? Drink plenty of fluids. Dress lightly. So you want to make it easier so when they want to give you an injection, they can pull up your shirt and just give you an injection.
And then after, like if you do happen to develop the fever, you want to have on cool clothes.
Yeah, so that's the dress lightly.
Yeah,
okay.
And then reduce the friction to the site.
Because every time you rub against it, it may be painful. Okay.
So in most cases, discomfort from fever or pain is normal. Contact your healthcare provider.
Yes.
If the redness or tenderness where you got the shot increases after 24 hours, so that's like you notice like a big red spot around it, or you notice like, oh, this pain is severe, I can't even move my arm, then contact your provider. They'll be able to guide you on what to do next.
Okay.
And then also, if you're just worried about the side effects, then contact your provider, and they, can probably ease your mind a little bit, let you know if it's normal, if it's not normal, and what you need to do.
Yes. And remember, it takes time for your body to build immunity after receiving a vaccine. So continue to wear your mask.
Yes.
Practice social distancing, 6 feet apart. Also check with your provider to determine if which vaccine is right for you, if any.
And recently they said that people who are fully vaccinated can gather in small groups.
I saw that.
without their mask.
I saw that.
So
I saw that.
maybe that gives you some encouragement. You miss your family, your friends.
Yes.
Get your vaccines. Make sure your friends are vaccinated and y'all can gather and see each other's smiles.
Yes.
Without having to wear the mask.
Yep.
So
okay. So that's good about the Johnson & Johnson vaccine.
Yeah. And if you guys have questions, always reach out to us.
Yes.
We're on Facebook, Instagram, YouTube, all those places you can send us messages, ask us questions.
Yes, you can.
And
just remember that this information that we're giving you is just solely information.
Mm-hmm.
It's to give you knowledge, spark a conversation with family and friends. Yes. It does not take place.
Does not.
Of your primary care provider. Period. Yes, it does not. Okay, it's just information for you so you can have a conversation with your primary care provider, family, and friends. Mm-hmm. Okay, so be what we want them to do.
So follow us on Facebook, Instagram, like, share, subscribe to our YouTube channel.
Yes,
and just tune in for more. Patient education.
Yes, because why?
Community is our beauty.